Story 1. That it's now very easy to get lens replacement surgery instead of laser eye surgery, replacing the natural lens of the eye with an artificial one to correct vision. It's the same procedure as cataract surgery, but people don't seem to realize it's an option. Story 2. I lost 2/3 of an ear to melanoma but was never interested in a prosthetic. I had the idea suggested to me that they could surgically reconstruct an ear from rib cartilage, modeled on my remaining ear and grown under the skin of my scalp. I now have an ear that, while a little different from the other, is fully a part of me with sensation and everything. Because I work in a customer-facing position as a teacher, the whole process took a few years, 3 surgeries, and a handful of broken ribs for crafting components, but it cost me just the price of a return bus fare when I wasn't allowed to drive after anesthesia. I tell the kids I teach that I lost it in a fight with a bear. Edit, because this gained some traction, it's worth mentioning that only a handful of people around the world can perform this kind of reconstructive surgery. Part of the delay in getting mine done was because the first surgeon, Greg O'Toole, spent summers, the only time I was free from my teaching job, in developing countries, doing cosmetic surgeries to improve the lives of impoverished children. Story 3. Nail prosthetics. Crushed one of my fingers putting a nail into the wall a few years ago. It was a pretty easy fix. Edit. The nail was an easy fix. The finger I had fixed first was not so easy. Story 4. Facial reanimation surgery after facial paralysis involves techniques with a mix of nerve transfers and muscle transfers to return some motion. This is often done for a combination of cosmetic and practical reasons, such as eyelid closure. Story 5. Forehead reduction surgery. Pretty self-explanatory. They hide the scar in your hairline. A pretty popular TikTok girl got it, and while it looked a bit crazy at first, I don't think anyone would notice the scar now that it's healed. Story 6. Abdominoplasty or tummy tuck as functional reconstruction of the abdomen after multiple childbirths. Most women whose abdominal muscles do not rejoin after childbirth believe they have to endure reduced functionality, strength, flexibility, and persistent pain, especially in the back. It is a major surgery. However, when performed by a highly qualified physician, it can completely change the lives of those who receive it. It is not suitable for all women with abdominal separation, is expensive, and is most likely not covered by insurance as it is still considered a cosmetic procedure, but it is an absolute game changer for many. Story 7. Penile prosthetics involve placing a balloon in the penis that you can inflate with water by squeezing a pump behind the scrotum. They are intended for people with erectile dysfunction. My father-in-law is a urologist and performs many of these procedures. It was fascinating hearing him describe it. Story 8. You can get Botox to help with migraines. I have had migraines for the past 28 years since I was in 7th grade and have seen neurologists and other specialists. It was not until last November that a new neurologist I am seeing suggested this procedure, rather than just prescribing another triptan medication. The Botox is injected into your head and neck and basically paralyzes the nerves in those areas so you do not feel migraine pain. It is not a permanent solution, but it lasts for a while and is definitely something that most people with migraines do not realize is an option for them. Story 9. Not technically cosmetic, but absolutely has a noticeable impact on how you look. Rotationplasty. It attaches your foot to your knee, backwards. Primarily used in leg amputation cases in which the lower leg is cancerous but the foot and upper leg are okay. It means you'll have a backwards foot instead of a lower leg and can put that into prosthetics to walk. Story 10. Deep or deep flap reconstruction after a mastectomy, breast tissue removal. Though apparently, this is quickly becoming the gold standard. I had a bilateral mastectomy back in 2018. The more well-known refill or reconstruction options are either implants or tram flap reconstruction, which uses abdominal skin, fat, and muscle. Implants have to be replaced every 10 to 15 years, and on rare occasions they may be rejected by the body or burst. Tram flaps generally reduce your ability to lift due to missing muscle in your abdomen. There are a few different types of tram flap options that use varying amounts of muscle. The deep flap or deep flap, which is the term my plastic surgeon used, uses skin and fat only. It's normally only available to people with more stomach fat so that the surgeons have enough to refill the breasts as close to the size they were before surgery. It's essentially a tummy tuck, but the fat gets used instead of being tossed. Story 11. Gum reduction surgery. Many people who have a gummy smile with small teeth actually have regular-sized teeth hidden under the gums. I had it done a few years ago and wish I had done it sooner. I used to be embarrassed by my smile. Now I love everything about it. Story 12. You can get the size of your earlobes reduced. Some people think they have big ears, but sometimes it is just the earlobes creating that appearance. It is a pretty simple procedure and can change your life. Story 13. Doesn't necessarily fit the threat, as laser eye surgery is well known as being possible, but I don't think people realize just how straightforward it is. In and out of surgery in about 10 minutes, no pain, just mild pressure. A few hours spent like you've been cutting onions all morning, only when eyes are open, take a nap. Then the next day you never have to mess around with contacts or glasses ever again, well, a decade or two depending. Best money I ever spent, and the cost was spread over 18 months at 0% finance. Probably cost as much as I would spend on contacts or prescription lenses in a 5+ year period anyway. Can't recommend enough. Look into a free consultation as soon as possible. Story 14. I had gastric sleeve surgery. I thought you needed to be around 400 pounds for it, so I never considered it. I was 219 pounds and got approved. Insurance covered it after I paid the deductible, and my only bill was $250 for the overnight stay in the hospital. If insurance hadn't covered it, I couldn't have afforded it. It's 20 months post-operation today. Now there is no need for heart medications, cholesterol medications, diabetes medications, or sleep apnea equipment. I had part of a toenail removed due to constant infections from ingrown pieces. It never got infected again. Story 15. Are you a woman who doesn't want kids anymore? Are you getting any sort of upcoming surgeries? Ask your doctor if they can also do a tubal ligation. Many doctors are including it now if they are doing any other work in the abdominal area. Story 16. Vocal feminization surgery recovery is pretty daunting, since it involves at least a month where you're not allowed to vocalize at all, including coughing, or else you'll mess things up. However, it can apparently work very well, although it is still only recommended for people who can't achieve a feminine voice in a more conventional way by practicing with a speech pathologist due to that recovery process. Story 17. A magnetic implant. I had mine done about 8 years ago when I was getting more body modifications done, and it's so fun. The magnet is implanted in my ring finger, and it allows me to feel electromagnetic frequencies. I can feel the pulse of a microwave when it's on and the sensation of buzzing when I'm around electronic things that aren't insulated well. Aside from that, it's a fun party trick. I got it because I was curious about the new sense people said they developed. I didn't entirely think that was real. It was a surprise to me after I got the implant when I felt it. The only way I can describe the sensation is like a static pulsing and buzzing that feels like it's happening naturally in my body, radiating from my finger up my arm. Nowadays, I don't notice it as much anymore unless it's something that creates a lot of sensation, like an air fryer. It's not distracting or anything, and I haven't had any issues with the implant. The bizarre thing to me about the sensation is how natural it feels. Also, I am able to get a magnetic resonance imaging scan with it, and apparently enough people have them that when I needed a magnetic resonance imaging scan, they weren't phased. They just treat it like shrapnel and brace the area. When I needed a magnetic resonance imaging scan, they told me to expect some vibrations or a very slight warming sensation, nothing painful. But they assured me I would be fine, and they have done magnetic resonance imaging scans on people who had them before without any issues. Story 18. It can be done to both your thigh bone, femur, and lower leg bones, tibia and fibula. It's a complex procedure involving surgically cutting the bone and inserting a nail in the middle of the bone called an intramedullary nail. Depending on the equipment used and which bones are being lengthened, individuals can expect to have an external fixator, which allows the individual to lengthen the distance between the upper and lower bone portions. Over time, the bone will heal and form a callus around the intramedullary nail, which will initially be soft but harden as the tissue ossifies, becoming more like mature bone tissue instead of initial tissue. Story 19. Foreskin restoration for men who were circumcised. They can graft skin from your forearm to your penis. I don't know much about it beyond that. I don't know how the final product looks, and obviously you won't get nerve endings back. Story 20. Non-surgical blepharoplasty, also known as eyelid surgery, addresses dark circles under the eyes to even out the skin color. It involves an injectable filler that adds volume under the skin where dark circles form. Many people's dark circles are caused by thinning of the skin under the eye as they age. A lack of volume in the skin and fat under the eye causes blood vessels beneath the skin to show through, making the area appear dark. A quick injectable can address this issue. Alternatively, fat can be repositioned under the eyelid skin to fix dark circles. Conversely, there are surgeries available to remove saggy eye bags as well. Story 21. Not necessarily a surgery or anything, but it is a body modification, so I will post it here. Some African and Asian cultures use smooth metal rings placed around the neck to give the appearance of a longer neck. The Padang women from Myanmar achieved the look of a longer neck by applying more and more rings year after year, which compresses the collarbones and ribcage and pulls a few thoracic vertebrae into the neck. Pretty metal, literally. Story 22. Honestly, I am intrigued by things like dimple creation surgery. It is cute but kind of extra. I wonder how many people actually go for something like that. Story 23. A lot of guys who suffer from phimosis come into urology to ask for a full-blown circumcision. Many of them didn't even know that we have several other treatments and procedures that we try first before cutting any healthy tissue off their body. Steroid creams and stretching therapy or dorsal slit or a frenuloplasty are all very mild procedures and fix 99.9% of all the cases that I saw. Story 24. I don't hear a lot about hair transplants, but it is something I've become aware of in the last few years. Not only can it help men who are unhappy with their temples or restore bald patches, but also transgender women to give a more feminine hairline. Story 25. Here's one that's specifically not done for cosmetic reasons: the Krukenberg procedure. If someone has a hand amputated but not the rest of the arm, they can separate the two bones in the lower arm and reattach some muscles to make a crab pincer-looking thing that's a lot more useful than a stump is. It would probably be in much wider use if it were more aesthetically pleasing. Story 26. People don't realize there are some surgeries that can get rid of your gummy smile. 9 out of 10 people need aesthetic crown lengthening. 1 out of 10 people need lip repositioning, also known as reverse vestibuloplasty. Everyone knows that one person who shows all gums when they smile. A good example is Miley Cyrus when she was young compared to now. She got gummy smile surgery in addition to her veneers. Story 27. I've always thought it's cool that you can treat a high smile by getting Botox in the muscle that controls your upper lip. The Botox freezes the muscle a bit so it doesn't pull up as far when you smile. Story 28. So much that can be done with fillers. This was certainly the case about a decade ago. Assume it is still done today. So think of the fillers some women use to plump out their lips and apply to 1. Improving breast contour, not so much size as shape. Improving muscle definition. Don't have quite the bicep or six-pack you want. Fillers. Penis shape. Alas, doesn't work well for overall size. But if your mushroom isn't mushroomy enough, you have options. Story 29. It's crazy how many options there are. I never knew you could get things like calf implants. Like, who even thinks about that? It's fascinating, but also a bit over the top. Story 30. Voice deepening surgery. I had a higher-pitched voice. They go in and adjust your vocal cords, and now I sound like a typical dude. A few weeks of a killer sore throat and not being able to talk, but worth it in my opinion. Story 31. Not really a surgery, but I put on these contact lenses when I go to sleep, and when I wake up I have perfect vision for about 24 hours. They are called orthokeratology lenses. Story 32. There was a football team in Italy, I want to say Lazio, but I don't feel like looking it up. They had a falconer. He was recently fired for showing off his surgical penis extension on social media. Story 33. Lots of body modifications. Here's a short list of the ones I have. Tongue split/bifurcation. The tongue has a nice split down the middle. Each side can be moved and controlled independently. I've had mine for about 4 years, split twice to go a bit deeper the second time around. Very awesome, super cool in my opinion. Coin slot slash cartilage punches. Most people see large holes in the ear and think it's just stretching by a piercer. But in fact, you can cut out chunks of cartilage to create big holes in your ear. I have a coin slot on my right upper ear in the helix area, where I have a stack of rings rather than an actual piercing. Magnetic implant. I have a small magnet in my right ring finger. I can pick up nails, paper clips, screws, and other small metal objects with it. Also, when near an alternating current, it vibrates in response and I can feel it. Mostly for the aesthetic, but it was helpful when I was doing some electrical work in my home to check for live wires. Apodravia. Most people know of the Prince Albert piercing, which goes out the bottom of the urethra, but you can also do a straight bar that goes through the bottom of your urethra, out the top, and then through the glands. Ones I don't have. You can also get subdermal implants of various sizes and placements. Pretty much anywhere on your body, you can get the skin lifted slightly and place silicone implants under it. I've even seen people who had a dog they got cremated, used the ashes to make a silicone paw print, and then had it implanted in their body. So cute. Umbilectomy. You can have your belly button removed. Just cut into your belly, pull it out, and sew it up. Easy.